Hello, hello, welcome.
Hello, how are you?
I'm good. Thanks for coming.
Thanks for having me.
Yeah. Um, yeah, we'll start in about a minute or two. Um, we we are live now, so
Okay, great. Give me just 1 second.
uh yeah. Welcome to this episode of the Magnet Podcast. Today we are privileged to have as our guest Mr. Labi Avidu, who is the CEO for Medication Management Partners based in Crestwood, Illinois. He has a lot of experience as a pharmacist and also as a manager in that industry. His team has won the Inc. 5000 award for the last 2 years. And on this note, let me say congratulations.
Thank you very much. Appreciate it. Thanks for having me on.
Yeah, and he also holds a Doctor of Pharmacy degree from University of Oklahoma. And I'll bet he's a Sooners football fan.
Absolutely. You know it. Boomer sooner. Sooner born, sooner bred. When I die, I'm sooner dead.
Good to have you. So, this podcast is mainly for influencers and thought leaders. And today we'll have one of the influencers and a thought leader. So, without much further ado, I'll let him also add a few remarks to my introduction, and we'll take it from there.
Thank you very much. Yes, my name is Labi Avidu. I go by nickname. It's a little bit easier on everybody. I'm the co-founder and CEO of Medication Management Partners. It's a pharmacy we started in 2009, and it is designed specifically to provide services to assisted living, memory care, and behavioral health organizations. We are, to date, servicing about 100 different communities, providing pharmacy services to roughly 6,000 residents. And the mission for us existing is to improve quality of life and simplify pharmacy for seniors and those who need our services.
Great. So, what will be the main difference between you, a retail pharmacy, an institutional pharmacy, or a no other pharmacy?
Great question. So the differences really are around technology, the infrastructure, including automation for dispensing, including software to support the communities. So technology overall, including automation and software, is a big one. The second difference is in process. A good way for me to summarize that is if you were to visit a regular Walgreens or CVS, the typical workflow is you show up to the counter, you drop off the prescription, or in some instances, the physician may call that pharmacy or send them an electronic prescription. The order entry technician on staff, the technician that they have on staff enters the prescription. They go get the medication, fill the medication, they pass it on to the pharmacist. The pharmacist has on average about 1 to 2 minutes to review that prescription, evaluate to make sure that it's appropriate for you, hand it back to the technician. The technician comes to you at the counter and says, do you have any questions for the pharmacist? If you don't, then here's a prescription, here's a copay, you're on your way. If you do, then of course the pharmacist is available to you for consultation. There are some pharmacies that are in the retail setting that provide some additional services, for example, immunization. They may offer delivery, and a lot of them are beginning to offer what's called a synchronization. In other words, if you have more than 5 or 6 prescriptions, as opposed to you having to go every week and pick up that prescription, they may schedule them so that you get all 5 or 6 of them or however many you need all at once. Again, whether they're delivered or whether you pick them up. The other thing that a community pharmacy nowadays will do is they may offer you a 3-month supply. Similar to a mail order pharmacy, you may be able to receive a 90-day supply of the medication. And then aside from that, they may have some additional things on the front end that you may pick up as you walk to the retail pharmacy or Walgreens. You may be able to pick up your milk, a couple of birthday cards, what have you. So that would be the experience in the retail setting. Our setting is much more different. So in our setting, we do not provide pharmacy services to the customer, the walk-in customer, if you will. So we do not have a front end. You cannot just walk in and drop off a prescription. We have agreements and processes with the community or the organization that's providing the care for that resident. In a lot of ways, we are integrated electronically into the computer system that that community uses. So in a retail setting, there's no such thing, right? You manage your own medications. There's really no intraconnectivity that's required between you and the pharmacy. There may be some things like apps or something like that where they remind you that, hey, your refill is ready. But by and large, there's really no connectivity between you and the retail pharmacy. On our end, we are very interoperable and integrated into communities that have electronic systems. So that allows us to have all of your information available to us to make the best judgment and analysis of your medications and what's due. And at the same time, it allows a community to have the most accurate list of all of the medications that are there. So we have this integration into the community. The workflow is also very different. So there's no prescription being dropped off. Typically, our orders are either coming from the caregiver, like the nurse, or they're coming from the physician directly to us, whether it's fax or via electronic. And then our technicians, our staff is really very specialized. So like I mentioned, in that retail setting, the same technician that is entering the order is typically then also dispensing the medication. In our setting, it is a lot more specialized. The data entry process is very complex because of all these integrations. In the retail setting, there's typically 6 or 7 fields that are checked for accuracy and appropriateness. In our setting, there's 25 checks for accuracy.
Wow.
A lot more complex that is required. The other thing that we do that's different is in a retail pharmacy, you may get a 30 or a 90-day supply. In our setting, because our average resident is 88 years old, a big difference between our average patient versus a retail patient. Our average patient's an 88 years old, typically between 9 to 10 different medications. We have to provide services around compliance packaging. So as opposed to you getting 9 or 10 different vials of medications, we are providing an organization system. One of our customized systems is the MPAC, which is a dose compliance packaging where all of your medications that are due for a particular time of the day are organized so that you just take one packet, and whether it's your morning or your afternoon meds, they're all there. And so when you do that, and when you're dealing with residents that are more acute, they have more illnesses, more medications, and more possible changes, we cannot do a 30 or 90-day supply because there could be more changes. So we provide shorter cycles of dispensing. So we're dispensing a 14-day supply, for example, as opposed to a 30 or 90-day supply. It allows for more flexibility, reduces waste, and increases accuracy. Communities who may prefer a different system from the multi-dose, we will then offer them unidose compliance packaging so that they may have each medication in their own system of packaging that is packaged based on the date and day that and the time that the medication is being administered. So compared to retail, a lot more infrastructure, a lot more processes. In addition to those, then we're providing a lot of coordination of benefits. In other words, if you are eligible for Medicaid benefits, or if you are on a Part D plan, we're helping residents and families make sure that they're optimize their benefits. If they have a retirement benefit from their employer, we want to make sure that we are coordinated in those benefits so that they don't have to use the mail order pharmacy if it's not appropriate for them. Imagine, for example, if you are a resident of a memory care community, you're 88, 90 years old, you have a dementia, and all of a sudden you have to get your medications from mail order and get all 10 medications in 90-day supplies. Obviously, as you can imagine, that is not a good process for that particular resident. So we work with the family and the community to overcome those. So that's how we're much different from the retail. We also provide consulting services, nurse consultants, pharmacist consultants that are at the communities on a regular basis. We're providing daily delivery. If there is a need for an immediate medication, we're providing that medication right away, like an antibiotic. So a lot more infrastructure and services around supporting the caregivers, supporting the resident, and providing services to the family. Now, how we're different from a institutional pharmacy is that typically in an institutional pharmacy, the vast majority of their residents are in the skilled environment, in an institutional environment of some sort, whether that's a nursing home, a skilled nursing facility, maybe in some instances they may provide services to correctional facilities. In all of those settings, there is a lot more coordination of care. So standards are set at the federal level. Typically, you have the medical doctor, the medical director, who is in charge of the medical decisions for that facility, in other words, providing primary care services. The nursing director for that community or that entity who oversees all clinical decisions for that community, the executive director, and then the pharmacy, really for the most part making most, if not all, of the decisions well in advance. So it's a very well-structured sandbox, if you will, where a lot of the decisions are already made, and you as a resident and or as a family may have some input, but by and large, really the course of the services being provided is already in place and structured. In a senior living setting where it's non-skilled, the family has a lot more influence. The resident, by design of that setting, there is a level of independence that we still want that resident to have, a quality of life that we still want that resident to have. And that freedom also creates challenges because there's a lot less coordination of care in place. And so what our pharmacy does that a lot of long-term care pharmacies typically don't do is that we provide a lot of customization around the community and around the residents and the families' needs, so that they do not necessarily have to be in an environment where, you know, you have to do this, you have to do that. We want to work with the community, work with the families to create an optimal environment and pharmacy delivery system for them to optimize medication management. Again, improve quality of life, simplify their pharmacy experience. So as you can imagine, in a rural Wisconsin setting, the expectations may be different from a metro Wisconsin or a metro Chicago environment. Minnesota may be completely different. So we're working with each regional operator to really create processes and systems that work for their organization and that meet the family's needs.
Wow. So that means if I get it, it's there's a lot of collaboration between you, the facility, and the family of the resident. Is that correct?
Exactly. Absolutely. I mean, you've got essentially four main things that we are worried about. Resident safety and outcomes, number one. We want our residents to be safe, and we want them to get the best therapeutic outcome possible. That may mean taking less than 9 medications, so where we can consolidate, reduce those. That may mean less expensive medications when there's opportunity to help them save money. But we want them to have a safe and the most positive therapeutic outcome possible. So that's number one. The second focus is around caregiver efficiency. One of the main struggles in the senior living industry is that there's a talent shortage. There's not a lot of caregivers. There's a lot of turnover in the communities, and there's just simply not enough labor to meet the demand. In fact, the country is going to be in a really bad situation because we are going to double the number of residents who will need senior living services from about 40 million today to about 80 million by 2030. And we do not have enough caregivers in our country to take care of those residents. So what does that mean? You have to leverage technology, and you have to make the process as simple and as efficient as possible. So resident safety and outcomes, caregiver efficiency, and simplicity for them to be able to manage medications for these residents. Compliance, regulatory compliance then becomes really, really important because each state and each setting has different regulatory requirements. So we have to make sure that these communities are compliant with state and federal requirements with respect to the care and services that we're providing. And then the fourth and most and equally important is to help the operators manage the risks and liabilities associated with providing services to hundreds of senior residents, 80 years or older, who are taking 9, 10 plus medications, right? Roughly 10% of their claims associated with lawsuits or other issues where a operator is sued, it revolves around medication-related errors and mistakes. So anything we can do to help reduce and minimize that risk, again, patient safety is most important. So anything we can do to maximize patient safety, to simplify their pharmacy experience, improve their therapeutic outcomes, make the caregivers more efficient with a system that is simple for them to provide, and make sure that it's in compliance with the state regulations by default, then that helps the operators run a more effective community that is less prone to lawsuits and risk.
Okay. So do you have like a minimum number of residents in a facility that will make it viable for you to take that facility?
That's a good question. Our typical ideal setting is a community that has an occupancy possibility of at least 50 residents. So licensed for 50 residents. That would be our sweet spot. But we also provide services to communities that are much smaller than that have, say, 20 or 25. But they are typically belong to an organization with multiple communities like that. So the organization may have 10 or 15 of those communities, and so we're providing services to all 10 or 15. And so while they may be smaller in size, because of the scale of the organization, it allows us to provide our level of service and make it both effective for them, and obviously something where we could be successful in providing the services. Once you get into standalone communities that are less than 50 residents, it really becomes very difficult for a pharmacy like us to provide those services. That kind of community would probably be benefit more from a local pharmacy that may provide some or all of those services that we do, but at a smaller scale. What we're successful at is making sure that we can then help that organization, if they have 10 or 15 of those communities across multiple geographies, we can help that organization standardize that process, right? That's the benefit.
So that means if you go to a standalone facility of about 20 to 30 people, in a way, it's not going to work for you. And another way also is it's going to dilute your mission.
Correct. Correct. It's just, it becomes, we want to provide the same level of service to every community that we provide services for, right? Independent of how many residents they have in, we want to provide them, again, that resident safety, caregiver efficiency, regulatory compliance, and reduce risk and liability, right? Those are the four things that we're focused on. And so to do that, it requires a lot of resources and infrastructure, and it becomes financially not viable if you are dealing with a smaller community for an operator our size.
Yeah. So what are some of the technologies that you leverage for your operations? I mean, I don't want you to spill any industry secrets, but something you could share.
Sure. We have automation around packaging. So we have two different systems that facilitate automation for our oral solids. Think tablets and capsules that you would take by mouth. And roughly 90 to 92% of our entire volume of all prescriptions that are dispensed by our pharmacy are facilitated via automation. That's a big advantage between us and, say, a retail pharmacy. The vast majority of the prescriptions that are dispensed via our pharmacy are done via automation. So packaging are two forms of automation that we use. And then our softwares that we deploy around our pharmacy operating software, our document management software, our customer relationship management software are really all integrated with that automation packaging, with the electronic health records and the electronic medication administration records. If the community has a system like that in their organization, so our software is integrated in that. If they do not have electronic health records, we can provide them a platform that is very rudimentary, but it allows them to get off of paper. Instead of having to document and chart everything on paper, it allows them to potentially get off of paper for some of those things around reporting, around changing some of the order specifics. So it really gives them an idea of what being electronic looks like. So think of it like crawl, walk, run. So we can provide them this platform at no charge to them. If they're completely on paper today, they can then become electronic for some things, and it sets them up then for the next step of, okay, now we really want to get fully electronic. So we have that infrastructure and technology that allows them to do that. And then all these things around simplifying the pharmacy process help us so that we're synchronizing 90+% of the medications that the resident is on. We can synchronize those medications with our technology so that the refill is done without the nurse having to realize that, oh, I don't have the medication there. Or the caregiver, the med aid or the CNA going to administer or remind the resident to help the resident with the medication, realize, oh my gosh, we're out of the inhaler. We're out of the insulin. We're out of the pain medication. I've got to call the pharmacy, and now we've got to wait for this and when it's going to come. We have processes and software in place that allow us to automate that for 90+, like 92, 93% of the orders. The caregiver and the nurse do not have to experience running out of the medication at all. It's going to be there before they need it. And so that creates an environment for them that, again, is efficient and safe. So those are some of the processes and automation technology that we use. We then obviously have some other technology around business analytics, information, ability to look up residents' benefits, so that, again, we can help them coordinate those benefits, so we can help them shop across insurance plans to make sure that they've optimized their plan and their benefits. If we are providing services to a community in Minnesota and there's an antibiotic and we need to start it right away, we have technology and resources and processes in place to facilitate that directly with a local pharmacy, with a courier, so that the medication shows up. And again, the nurse or the caregiver doesn't have to worry about it. There's no added fee or charge to the resident. We're billing everything like they normally would have been billed if they'd gotten the medication from us, and it's all showing up automatically. So these are a lot of the things that we're doing today. Some of the things that we're looking for in the future: pharmacogenetic testing. So that you can test your genetics, know what your body will respond to, have that profile in our pharmacy system, so that anytime a new order is issued, we can automatically right away predict how you will respond to it. Telepharmacy. Instead of having to open a pharmacy in every state, to be able to have telepharmacy technology with, again, remote dispensing automation and maybe some skeleton staff, like a couple of certified technicians, and then using technology, having our pharmacists who are certified in geriatric pharmacy from our location in Crestwood manage that operation. So those are all some of the ways that we've leveraged technology and automation in our process, and that we're looking to do going forward.
Wow. So there are a lot of other CEOs and senior executives who listen to this podcast in the healthcare industry. So what advice or insights would you like to share with them?
Well, again, I would go back to focusing on those 4 things that I think are really important to senior living operators: the community executive directors, the caregiver decision makers, whether they're nurses, LPNs, or other. Resident safety. Those residents are moving into your community because they need help with their care. They're not able to manage their medications. Again, on average, they're going to be 88 years old with 9, 10 plus medications. The family has trusted you implicitly to take care of mom or dad. So safety and outcomes are critical. So what does that mean? What's the accuracy rate of the pharmacy? How many errors are they making? Does the pharmacy know? Do you know? There's not a process that I'm aware of today that is 100% accurate. There's just way too many things in play that we've just not been able to master that yet. When you start looking at what's the average error rate with respect to medication administration, it ends up being somewhere between 3 to 7%. So for every 100 orders, you are likely to experience a medication-related error 3 to 7 times. So for 1,000 orders, that's 30 to 70 errors. So now do the numbers. If you've got a community of 100 residents at 10 orders each, and you've got the typical average error rate, then your community may be experiencing 30 to 70 errors a month.
Wow. Even one error is too many.
Compromising the safety and the outcomes for that resident. So what's the accuracy rate of the pharmacy? How can they help you become more accurate? In the case of MMP, for example, our effective accuracy rate is 99.99%. So
that's a perfect score, right?
10,000 orders that we will dispense, we know that we will make one mistake.
Wow.
So not 100%, right? And we're working to get a lot better, but certainly significantly better than an error rate of 3 to 7%, right? So making sure that your pharmacy knows that, is upfront and open about it, and that they can help you optimize your processes, your safety for that, and the safety of that resident efficiency. Caregiver efficiency, then, if you're going to struggle with getting caregivers and keeping them there for a long period of time, you have to make sure that the process is simple and that it's efficient. So how does your medication management look like? Are you managing the rule? Are you managing the exception? A lot of the times what we tend to find is that the communities are managing the exception. They're spending a lot, they're managing the rule. They're spending a lot of times and resources on things that just typically don't change. And your best bet is to manage the exceptions and let the rule be the rule. And then focus your resources on those exceptions and how you're gonna manage that. And so what I mean by that is, for example, multi-dose compliance packaging. reduces staffing, improves efficiency by 75%. The amount of time that it takes to sort through multi-dose medications, organize those, pass those medications during med-pass times, check those medications in, is 75% more efficient than using unit dose packaging like 30-day bingo card, for example. So if you are making a rule so that every one of your communities is using bingo cards, you're adding about 75% inefficiency to your process. Now, why would you do that? If you have a lot of changes, if you have a highly acute resident population that requires you to make a lot of changes, then that would make sense. It would make sense to do that in a skilled environment where the resident is only there for a short period of time, a lot of turnover, a lot of change. Typically what we see in a senior living community today is that the new orders and changes are about 3% of the orders. So now for that 3%, if you make the other 97% have to comply because you have this 3% of orders that require changes, I just think that's inefficient. And looking at how the talent shortage is projected to increase, I just think you've got to do better than that. And so there's ways where you can manage that 3% and still make the other 97% really efficient, so that you are not treating the entire 100% as though they're just that 3% where there's a lot of changes. So efficiency and simplicity. How do you make it simple? How do you make it efficient? Really important. And then I would focus around regulatory compliance. There's a lot of communities, the scrutiny on assisted living is increasing, and it really is important for the industry to do a lot more around improving quality standards so that we don't have outsiders, federal agencies, then having to impose those on the industry. So regulatory compliance, increasing the standard of care voluntarily, right? As an industry pushing forward, I think that's critical. It's important to the success and the future of the industry. And really a lot of good work being done around that with organizations like Argentum, the National Centers of Assisted Living, the American Senior Housing Association. These are all great organizations. And then there's others, Aging 2.0. There's a lot of other organizations, and then industry partners like ourselves, like EHR and EMR companies, Point Break Care, Aldermark, ECP, that are really working closely with operators that are setting the standard. The Argentum top 125 operators in the country, these are all really good operators that are trying to raise the quality level and increase the standards so that compliance becomes something that it is baked into the process, and it's really something that it's well done without having to have outsiders and agencies start to impose regulations. There's a lot of that good work already being done, and it's incumbent upon the community leaders to make sure that their service providers are helping them with that. And then for the operators, managing and reducing risks. And so those include around census. There's a lot of competition now. There's a lot of senior living community being built everywhere. And you can only impress people so much by chandeliers and, wonderful open spaces. Those are all important. But all the data says food and care. Those are the things that residents really care about. Is they want to know that the meals that they're going to get are going to be good. They want to know that they're going to be taken care of. And 80+% of the time, like I said, medications are a critical component of that. And if you don't have a safe, simple, scalable system that exposes you to risks, those risks could be lawsuits, or it could be risks of losing it to the competition. And so that would be my advice to the operators. Focus on resident safety, focus on caregiver efficiency, focus on regulatory compliance, and focus on risk management and winning in the market.
Yeah. Oh, wow. My production assistant just sent me a note that people are impressed with your presentation, and in the not too distant future, we're organizing a panel on this particular issue, and they said they want you to be on that panel. So do I get a no or yes?
Absolutely.
Okay,
Absolutely.
great.
Happy to help.
That's you got it. You got it. He will be here on that panel.
Perfect.
So I mean, you have really, taken us from novice to almost experts in your industry, and that is not an easy task to accomplish. Congratulations.
Thank you very much.
Yeah. So so as a CEO, how's your typical day like?
How's my typical day like?
Mm-hmm.
Well, really, the way I view myself is a resource to our team, our senior our senior executive team, our mid-level managers, and our frontline staff. The way I view my role is, if you think of it as an inverted pyramid, most organizations are structured as a top-down pyramid, right? Where the senior executives and the CEOs at the top. The way I view my role is as an inverted pyramid. I am really at the very bottom, doing everything I can to help our frontline staff, our registered pharmacists who are certified in geriatric pharmacy, our technicians who are certified pharmacy technicians who are working every day with our caregivers. How can I help them have their resources so that they can do their job better and really enjoy and love what they do? How can then we help the mid-level managers and the senior managers, again, fulfill those needs of our caregivers? So my typical day is really around those activities. I'm looking at how can I help what are areas that our staff need, maybe some mentorship, they may need some assistance, a lot of pats in the back. My day is filled with really going around, talking to our staff, making sure that they understand how valued and appreciated they are, giving them specific kudos and thank yous when they've gone above and beyond, when they've lived our core values, and then providing constructive feedback wherever it may be needed. My day is filled around that, and my day then is also could be a lot of traveling with visiting our clients, our partner communities, visiting with our partners, stakeholder partners in the industry, a lot of associations, and then obviously with our senior leadership team, we have scheduled meetings around strategy, and those meetings are weekly, and so that's typically my day. But it's really built around a lot about taking care of our team, making sure that we recognize and reinforce our core values when they're being met and when they're being exceeded, making sure that really the way I summarize my role is to make sure that people want to work with us and for us. I want to make sure that people want to be here, that they are thrilled and challenged by being here, that they feel valued and they can contribute and they can grow professionally being here, and that we can, as a company, continue to grow and push the envelope around what pharmacy and medication management is in senior living. And that means spending a lot of times with our industry partners so that I can understand what are the challenges that maybe are realized today, or maybe challenges that people don't even know exist today, that if we can help overcome, could be a significant benefit to them.
Yeah. So I know you have clients over the Midwest. Do you have you have clients in other parts of the country?
Yeah, we're licensed in 10 states. We're providing pharmacy services in 5 out of the 10 today. 6,000 residents today, and across 100 communities. We expect that to be 7,000 residents by the first quarter in about 120 communities. Our goal is 12,000 residents by 2021 and 100,000 residents by 2030. So that will obviously mean that geographically we will most likely expand.
Okay.
And I'm sorry, I'm going to have to cut this a little bit short. I think I went a little bit longer than what my time was. Thank you so much for the time. I appreciate you having me on.
Yeah, so I'm just going to pause this and we will talk just a few seconds off air. So I'm pausing.